Well, my name's Dr. John Schnorr. I'm a reproductive endocrinologist in Charleston, South Carolina, where I have the pleasure of being the medical director of Coastal Fertility Specialists. I'm also the division director of reproductive endocrinology at the Medical University of South Carolina.
I'm Ken Mosestian, Executive Director of the American Fertility Association, and it's my pleasure to be here with Dr. Schnorr today. So, Dr. Schnorr, what is tubal ligation?
Well, tubal ligation is generally considered a permanent form of birth control, which is probably one of the most common forms of birth control used in America today. There are multiple different ways to do a tubal ligation, but we know that the fallopian tubes are very important for connecting the eggs to the uterus so that when the sperm swim through the uterine cavity, they can get into the fallopian tube, meet the egg, and generally fertilization occurs in the fallopian tube. That resultant embryo then in nature comes down the fallopian tube where it then lands in the uterus and grows in the uterus. And we learned many, many years ago that if you disconnect the fallopian tube, you make it so that eggs that ovulate out of the ovary cannot get down to the uterus, and sperm in the uterus can't get up to the eggs. Now, tubal ligations can be done at your cesarean delivery. If you have a baby and you have a C-section, they can disconnect your fallopian tubes then. Tubal ligation can be performed after you have a baby, and that can be done with generally a telescope that's put in your belly button where they can look down and take out a piece of fallopian tube or put devices on the fallopian tube that block the fallopian tube. So a variety of different ways to do tubal ligations. It's very important to know what type of tubal ligation you had because some forms of tubal ligation are not as easy to correct as others. For example, if they remove your entire fallopian tube as a form of birth control, that's something that a reproductive endocrinologist can't fix because there's not enough fallopian tube to put back together. If they simply put a clip or a spring on your fallopian tube, that tends to be one of the easier types of fallopian tubes to put back together if we decide to do that.
If someone is considering a tubal ligation reversal, how do they know if they're a good candidate for that or not?
It's a great question. Tubal ligation reversals can be reversed with very high success rates. What's important to know is, are there any other causes of infertility and what type of tubal ligation was performed? For example, a lot of patients when they come in to have their fallopian tubes put back together have a new husband. And often a new husband can mean that the sperm count could be different than it was before, and that could be a male cause of infertility we'd like to evaluate. Frequently, a tubal ligation is done many years before they decide they want it put back together, and a woman's age has increased. And as a woman's age increases, the number and quality of eggs in the ovaries decrease, and that could be a cause of egg factor infertility that we would want to investigate and to know about. So I would say if you're interested in fertility after having a tubal ligation, the first thing I would do is get my medical records from the doctor who tied my tubes so we could then as doctors figure out what type of tubal ligation was done. You should then meet in consultation with a reproductive endocrinologist who can help you understand other common causes of infertility and help you do research to see if there's another cause of infertility. That testing should include an ultrasound to make sure the uterus is developed okay. The ultrasound can also help us figure out how many eggs are still in the ovary as a sign of ovarian health. We would generally do hormone levels on the third day of your menstrual cycle to kind of count the number of eggs that are present. We would do a sperm count to make sure there's not a form of male factor infertility which is present. And at the end of that, understand what common causes of infertility are or not there and how easy it is to return the fallopian tube back to normal based upon the type of tubal ligation that was performed.
Doctor, can you talk about the potential success rates for people after a tubal ligation reversal is performed?
Right. So the success rates after reversing a tubal ligation depends on the components that are important for fertility. Depends on what the initial sperm count is, depends on what the egg count is, depends very importantly on the age of the patient, the female age at the time that the tubes are being reversed, and the type of tubal ligation that was performed. If you're a patient who's under 35 years of age, and the tubes can easily be put back together, and the sperm count is normal, and the female hormones are normal, it's reasonable to assume that the 2-year cumulative pregnancy rate after 2 years of regular intercourse after putting the tubes back together is in the 60 to 70% range. Now what's very important to know is that after your tubes have been put back together, if you conceive, you're at increased risk for an ectopic pregnancy, which is a pregnancy which can get stuck in the fallopian tubes. It's more common after surgery's been done to the fallopian tubes. And so if you conceive after your tubes are put back together, it's important that you quickly get to your OB/GYN so they can study the pregnancy to make sure it got to the right location. And if it's not in the right locations, there's surgeries and medications they can administer to help make it so that it's a safe pregnancy.
Dr. Schnorr, what are the possible complications from a tubal ligation reversal?
Well, tubal ligation reversal is a surgery just like any other surgery, and therefore it's going to have some risk associated with it. The primary risk is risk that's injury to the arteries, nerves, veins, bladder, and bowel, which are all structures that surround the uterus and fallopian tubes where the surgery is being done. The risk of injury is about 2 to 3 out of every 100 patients who are operated on. So 2 to 3 out of 100 patients will have an injury from the surrounding structures from the surgery alone. Probably a more common complication, though, is that the surgery goes very well and that you do get pregnant, but the embryo gets stuck in the fallopian tube when it's moving through the fallopian tube, causing what we call an ectopic pregnancy. An ectopic pregnancy happens in about 10% of all pregnancies that happen after tubal ligation is reversed. That's generally diagnosed by your hormone levels not going up well, by you having pain or vaginal bleeding during the pregnancy, and often your doctor can see it very early on ultrasound, and if you had an ectopic pregnancy, could treat it with medications or surgery so that there's no risk from that ectopic pregnancy.
Does insurance typically cover the costs of a tubal ligation reversal?
Insurance typically does not cover the cost of a tubal ligation reversal, although some patients have unique insurance policies. Sometimes the military actually covers tubal ligation reversals. So most of the time it doesn't, but I would strongly encourage you to check with your insurance carrier to see if it's got coverage.
Doctor, what are the alternatives to having this procedure done?
So tubal ligations are a common form of infertility, and the ways to help restore your fertility after tubal ligation would be number one, surgery to put the fallopian tubes back together. We just talked about that. The second option is called in vitro fertilization. It's a way that actually bypasses the need for the fallopian tube to conceive. It involves medications that we can generally give the female who helps her make more than one egg. Ultrasound while she's making those eggs tells us how many eggs she's making and when those eggs are likely to ovulate out. And then towards the end of the procedure, we can administer medications so that an ultrasound can guide a needle into where the eggs are growing in the ovary. The eggs can be retrieved from the ovary and put into a test tube. They can then be fertilized in a test tube, and the resultant embryo is put back into the uterus 3 to 5 days after the egg retrieval. In total, the procedure of IVF takes about 6 weeks. It bypasses the fallopian tubes. The tubes are still tied, so they're still disconnected. And the pregnancy rate depends on a woman's age and the number of eggs she makes, but is generally around 50% chance of pregnancy per try with in vitro fertilization if a patient were under 35 years of age, had normal hormone levels, and had a normal sperm count. The downside to in vitro fertilization is it tends to make multiple pregnancies, that generally more than one embryo is put into the uterus. More than one embryo makes an increased risk of more than one baby, which has a complication of multiple pregnancies. The positive part about in vitro fertilization is that you can have children and still have birth control in place in that your tubes are still tied, so you don't need to worry about birth control later on. And the other benefit to in vitro fertilization is you generally conceive a little bit quicker through the in vitro fertilization process than if you had your tubes put back together and you tried to conceive on your own over the next 2 years.
So doctor, for someone who is considering tubal ligation reversal, what's a message you'd like to leave them with?
I think the important thing is to think about if you want to reverse your fallopian tubes, it's important to do it sooner rather than later. We'd rather try to help you get pregnant by correcting your fallopian tubes at 33 years of age than 38 years of age. So time is important, number one. I think number two, you need a full fertility evaluation before you have the tubes put back together. That includes checking egg number, sperm counts, uterine content, make sure the uterus is normal, make sure there aren't any other causes of infertility before you move forward.